Hello, everyone, and welcome. My name is Joanna Rivera, and today we have Dr. Aviva Romm. Hi.
Hi.
Before we start, I wanted to do two logistical things. First is that we will be recording this for our YouTube channel and to make it as a podcast. So for those who are here, you will be watching the interview live. And you will be able to ask your questions about halfway into the interview. I have some questions I have prepared. And so then hold your questions into the end because you'll be able to ask it via the chat, or you can unmute yourself and ask your question to Dr. Aviva. Yeah, those two things. So thanks everyone for being here and for those who are watching or listening. And thank you, Dr. Aviva. We are so happy to have you. It's such an honor. You've been such an inspiration. You're a women's health advocate and an example of how women's health can and must be practiced. So I'll introduce you very briefly and then
Okay.
we'll just dive in. Dr. Aviva is a Yale-trained physician specializing in family medicine and obstetrics. She also happens to be a midwife and a herbalist. She is a founding member of the Yale Integrative Medicine program. She's also a best-selling author of, among others, Hormone Intelligence. And you've been such a champion in advocating for maternal health, the need to prioritize maternal health and women's health. And you are a champion on speaking about PCOS and menopause. So we are so honored to have you here.
Thank you. Thank you for that lovely introduction too. It's actually it's funny too, sometimes in this world, even for myself, I get so busy or so caught up in perfectionism and all the things to do and social media likes, and sometimes just actually hearing someone else reflect back to us. I'm thinking almost as a practice, I want to start every patient visit with, "Hey, let me introduce you to yourself."
Yeah, that's
Thank you
lovely.
for
That's
that.
lovely. So, I mean, just to start, we know we both work with women. We as a patient organization, you see women every time, in your consult, in your courses, in your speaking events. And we both know that PCOS and menopause we still have a lot to do in terms of stigma and misinformation. And this is preventing women from getting the support that they need. So we're so happy to dive into the terrain with you. You've been, exploring this and speaking about your experience. And yeah, so
Well,
yeah,
and
let's
I'm so pleased to be able to talk with you about these topics. And it's just wonderful that, as an organization, you have really focused in on PCOS. Women need places to go that they can feel not alone and also get the information they need. So it's wonderful that you do this.
Yeah, thank you. And we're so inspired, we get women all the time asking questions, we are referring them to the guidelines, to evidence-based information. This is what we do. We are just, advocating for more and better and evidence-based treatment and information to be out there. So this is just a seed, and we're so happy that you are
Thank
part
you.
of this seed dream. So just to give a tiny bit of a context uh, about where this idea started last autumn for PCOS Awareness Month, we talked to Dr. Esther Banki, which is researcher and a gynecologist here at the University of Trondheim in Norway. And she's working on a clinical trial for a possible drug for teenagers. And in that interview, we were speaking about the different needs through the life stages of a woman with PCOS. There's different needs in puberty, there's different needs in pregnancy, birth, postpartum, and there's different needs in perimenopause. So yeah, to have a life cycle approach to PCOS and to the different needs, not just focus on infertility, which is, like the main
Yeah.
focus of PCOS. So for those of so when we had that interview, we had this idea of having a series on the different life stages and talking about perimenopause. We've never heard anyone talking about menopause and PCOS. So you were the first person I thought about, because you're such a knowledgeable, reliable source of information, and you meet patients every day. So we want to pick your heart and your brain,
I love
uh,
that.
to share your experience. So I wanted to start, for those of you who don't know you, because this is a mainly Scandinavian um, audience that may not be familiar with your work. Can you share a bit about your journey and what inspires you to advocate for a holistic
Ah,
approach to women's health?
absolutely. So my journey actually started when I was a teenager, in that I went to college very early. I was 15. I wanted to be a physician. And in those first few months, not only had I personally been going through very challenging kind of psycho-emotional things around my hormones. Came from a very stressful home life. I grew up in what in the US we call a housing project, so government subsidized housing, a very stressed out single mother. I was traveling 2 hours each way to commute to my high school. And during that year, I gained 35 pounds and was becoming depressed. And somehow, almost miraculously, I had the idea to leave school and go to college. And I got accepted to this college that takes gifted young people, got a scholarship. And during that very first semester, and this was 1981, I'm 57 now. So this was, there wasn't really like an organic food movement. There were some organic farmers in the Northeast and Vermont, but here in the US, there was nothing. There was no like, you could find like the little health food store with the wooden floors and like bins of things, but that was hard to find. And there wasn't anything called integrative medicine yet, holistic medicine. There were no things like that yet. There was no herbal medicine movement. There was no major midwifery movement. It was very back to the land and very hippie. And you had to really look for what you wanted. So I started getting exposed to information and books, the very few books that were out there, but also even in my studies, information on women's health politics, the history of Western medicine. And at the same time, I started getting very deeply interested in the environmental movement and the connection between food and pharma and big agriculture. And I took kind of a major left turn. One, became a total hippie. I actually grew dreadlocks and like was really like was only getting my clothes out of like secondhand or free boxes, and went completely organic to the extent that I could. I became a vegetarian. I was doing it for environmental and political reasons, but what was really interesting was that I lost the 35 pounds I'd put on. I wasn't having crampy periods. I wasn't having headaches. I wasn't having stomach pains. Like all the things that I just thought were normal to live with, boom, were like gone. Seasonal allergies. I had terrible seasonal allergies. So it was really kind of transformative. And I was like, oh, this is interesting. So long story short, I kept studying and studying. I left school at 16, apprenticed myself to midwives and herbalists. By the time I was 20, I was a fully practicing midwife and herbalist. And then fast forward a couple of decades, now a lot of these things are becoming a little bit more recognized and more common, but the medical model hasn't changed at all, right? The C-section rate when I started studying midwifery in 1981 in the United States was 19%, going up to 24%. That was considered high. By the time I was really like deeply into my, almost 2 decades of midwifery practice, it was 34%. And that was the average, which meant some places were a lot higher. Maternal mortality was already terrible in the US. Like, if your child got an earache and you wanted to not just give an antibiotic, your pediatrician might say something to you like, "But do you want your child to go deaf or die?" So I realized that while the out of the box movement was changing, the in the box was exactly the same. And people who necessarily needed the medical care that was in big box medicine were going from like a pasture to a wolf's den. No disrespect to wolves. Wolves are great, but you know what I mean, right? They were like these gentle people looking for something different, all of a sudden going into hospital being really mistreated because they had tried these alternative things as if somehow they were irresponsible parents or irresponsible pregnant people or irresponsible women. And then nobody on the inside had a lick of an idea of what they could do. So I was like, all right, I now have 4 kids. I'm like, I'm doing it. I'm going back to school. I'm going to medical school. And that's what I did. So in 2005, I started med school at Yale. I did my internship in internal medicine, my residency in family medicine with specialties in integrated medicine and obstetrics. So I do full family cradle to grave is what we call it. I take care, I do pediatrics, um, everything, hospital medicine and clinical medicine. That's what I'm trained in. And now my practice is largely telemedicine, and I focus largely on women's hormonal health across the life cycles. But that also includes things like autoimmune conditions, mind and mood, all the things that come along with all of that. And I do take care of kids too. I write books and I teach online programs. That's what I do. I live on 7 acres. I have a 2,500 square foot organic vegetable and herb garden and still live, pretty much the same. Like I try to live as natural, healthy, and mission-driven life as possible. So it's been an interesting journey. And what keeps me inspired every day is not dissimilar to what you said. It's hearing from the women. It's the stories. It's the stories. It's the stories. It's the woman who, is miscarrying and goes into the hospital and doesn't get good, loving, caring, thoughtful treatment. Or the woman who's in a state now where she can't even get miscarriage care because it may be illegal because of our crazy politics around reproductive health in the United States. I hear from women all over the world who, instead of waiting 5 years to get a PCOS diagnosis, they read about something that I had online and they're like, oh, this sounds like me, or with endometriosis, or, all along the life cycle. So that's what I do. That's who I am. I'm married. I've been with the same partner for 40 years. And my youngest baby is 30, and my oldest is 30, turning 39. And I have 2 grandbabies who I got to midwife at home. And that's exciting too.
Mm. Thank you for sharing your story.
Yeah, you're welcome.
Yeah, such a beautiful journey, and that you get to bring that to other women.
Yeah, it's a gift. I feel very grateful. Sometimes overwhelmed, but mostly grateful.
Yes, yes, I can hear you. I can hear you. So I think that's a beautiful turning to my next question. You have a strong sense of a woman-centered approach. And in your book, Hormone Intelligence, you speak about trusting our bodies, coming back to our bodies, listening. And at the same time, you speak about how society has taught us to disconnect from our bodies and to see hormonal imbalances and hormonal symptoms as something to, take care of the symptoms, as opposed as to listening to our bodies to really be inwards and ask what is it that our bodies are telling us.
Yes.
So what makes you have that woman-centered approach to help to PCOS to
Yeah, well, I think there's a few layers, and you touched on a lot of them. One, when we look at the history of medicine in Europe and in the United States, and women's spirituality and women's intellects, those have all been suppressed. Like very early on, when we go back to like Descartes and Bacon, we're talking like the 1400s, the 1500s, there was this idea that women and nature were basically resources to be used. And all of our inner knowing was considered irrelevant and kind of stupid compared to science. And as women, we have deeply internalized that that value system has really not changed. And it shows up today, right? When a woman goes to her doctor and says, I'm having horrible period pain and I'm not sleeping well before my period and all the things. And your doctor says, oh, well, it's probably just stress. Or when a woman goes to her doctor and says, I've gained 30 pounds, I'm losing my hair, I haven't had my period in 4 months. And the doctor says, Well, it's probably just stress. Or worse, your doctor says, well, if you just lost weight. And so we're taught to just assume that our body's messages are insignificant. And we're taught to respect the external voice, which is usually a male authority voice, as the authority on our own body. So what ends up happening is we often end up ignoring symptoms that we're actually having and saying, oh, that must just be normal. Because we're taught, right? It's normal. Like one of the things I say in my book is being a woman is not a diagnosis, right? Like you can't just say, oh, it's period pain because she's a woman. Oh, it's cramps. It's because she's a woman. Oh, it's painful sex. Oh, it's because she's a woman, right? It's because you have hormones. No, it's something's not flowing the way it should in our hormones when that's happening. And it's very easy to be in a doctor's office and feel uncomfortable or feel like we're being dismissed or not heard or being given a wrong diagnosis and still not say anything because we're actually not just uncomfortable speaking up, but we're actually doubting ourselves. Like we actually have been taught to gaslight ourselves. And so on the one hand, we're not listening to our bodies. And on the other hand, we're not trusting our perceptions of reality and how we're being treated. So we end up suppressed in so many ways. The other thing is that, I mean, even as we are now, right, it's such a gift and a blessing to be able to talk to each other across an ocean and share this information with each other and have this conversation. But we are literally spending so much of our time from the neck up as women online with all of the work we do. I know for me, as silly as this sounds, sometimes at the end of the day, my husband usually does the dishes in our house. He just loves that meditative time and he loves to give me a break. And he's always just been like that. But sometimes when I'm washing the dishes or just doing something kind of like normal and basic and physical, I'm like, oh, I feel like I'm dropped into my body and just doing something that is human as opposed to being online all the time, which also keeps us more in our head and detached from our bodies. It also keeps us sedentary, which isn't great either. So for so many reasons, I feel like dropping into our bodies is important. And when you have PCOS and your body's giving you these signals and messages, rather than letting somebody else tell you, oh, that's just normal, or that just happens, or, you know, it's
That's how
stress,
it is. Yeah.
it's all the things. No, like there's something else going on that's leading for, and I just really want to say this bit about, because a lot of women, not everyone with PCOS is in a bigger body. There are lots of very lean women with PCOS, but the medical model associates PCOS with being overweight. And what so many women don't know is that their cravings and their binging and they're like always being hungry and going for carbs and things like that is not anything but a symptom of the PCOS. So when a doctor says, oh, just lose weight or go on a diet or da 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 da, and they're essentially blaming the woman rather than going, wait a minute, that's another symptom. So it's really important to trust your body, respect that those symptoms aren't something wrong with you. There's something going on that needs attention and that you deserve to have that attention. But also, if we're up here all the time ignoring what's going on in the rest, that's not the best for us either. So
Mm. So much wisdom. Thanks for sharing that. Yeah. I feel also there's this split between mind and body, and mind is more important than body, and body we have to suppress. And you spoke about
yeah.
this before, like, we've
But
even
there's no
ignored.
separation. There's no separation between mind and body. And I once had an opportunity to study with one of the world's leading neurologists at Harvard. And he asked the patient a question. Do you think this is in your mind or do you think this is in your body? And the patient said, well, no, I've really spent time with this person had an injury. And like, I'm sure this is happening in my body. It's not like psychological. And the neurologist went like this. Now you're too smart to think that there's any separation between mind and body. And when we live in that dichotomy, then we're using our mind to judge our body, or we're using our mind to ignore our body rather than being an integrated whole. And we know, And this is very important with PCOS and any hormonal, but also gut health, mental health, all of the things. We tend to, as women, be stereotyped as hysterical or have psychosomatic, or again, it's not that stress can cause illness, but it's not just stress. But it's really important to realize that what happens in the body as affects the mind as much as what's happening in the mind affects the body. So if you're having gut disruption, that can show up as negative thoughts. It can show up as food cravings. It can show up as depression, anxiety, sleep problems. If you're having irregular periods and a lot of hormone disruption, yes, your pituitary is in your brain and that's signaling your ovaries, but also those hormones are signaling changes in your brain. So to even separate it, it is just one continuum. And I think when we can step back and say, separating like mind, body, emotions, spirit, and say, we're one whole person, what's going on here? We can really deepen and quicken our ability to actually get not just personal answers, but medical answers, right? Like if a doctor says to you, hey, I think that's in your head, I'm like, well, what? I'm one person here. We don't know if what's happening in my mind is what's going on in my body, but it's all happening. And I think that's a very unique and very deeply feminine shift that we can start to make. And it's very powerful.
Mm,
And
I
because
love
also
that.
what's happening in culture, right? Like what's happening in the culture around us, that lives in our bodies too. I was thinking about this the other day. I grew up in a home where my mother and grandmother, it was the 1970s. Every woman was like either on a diet or had a thyroid problem. Right? Women were put on thyroid problems to get skinnier. And I had an uncle who was obsessed with thin women, and he only dated tall, thin fashion models. So even as a young child, even though in many ways I grew up with generally healthy body images and much better than what a lot of young girls are growing up with now with the internet, some part of me deeply, deeply, deeply was instilled in this culture of identifying body shape and body size with value. And those are things that get into our bones that affect how we experience our life, our food choices, our health, our self-perception, our value, how we're treated in the doctor's office, all these things. So we have to really look at culture as part of what is affecting us too.
Yeah. Yeah, I love that. I totally agree. Culture influences our experience of health and our experience of our own body. There's so many questions I want to ask, but I want to go back to insulin resistance because you touch on weight and the perception of weight, body mass on PCOS. And I want to go to insulin resistance because 70% of people with PCOS have insulin resistance. And you talk a lot about this as a root cause of PCOS in hormone intelligence, the influence of insulin resistance in androgen production, testosterone especially, and then that converting into estrogen, leading to many of the symptoms. You also talk about insulin resistance also disrupting some of the other hormones that you just said that influence hunger and satiety.
Yeah,
And so I want us to dive a little deeper on that because,
sure.
again, there is this insulin resistance, weight gain. Here in Norway, still the recommendations are to reduce calories, and we in
Mm-hmm.
PCOS are not agreeing with that. So I want you to unpack that for us.
Yeah, so yeah, great questions and so important. So for those who are listening and aren't familiar or watching and aren't familiar with what insulin resistance is, this is when our cells, which require insulin for a whole variety of functions, including taking blood sugar out of our circulation and bringing it into the cell for fuel, are not being able to lock and bind onto the cell because the cell itself becomes resistant to picking up the insulin. So it's like if you went to your house and your key got bent or somebody had changed the locks, you just can't get in, and then you can't do what you were supposed to do in your house. So that's what happens with insulin resistance. And along with that, blood sugar builds up in the circulatory system, and that becomes very inflammatory. And it can also change the hormones that we're producing. So for example, we know that insulin resistance, when it affects the ovary, leads to increased production of testosterone, which is an androgen, one of several. And when we have those increased androgens, that's what leads to a lot of the classic symptoms of PCOS, what was traditionally called male pattern hair loss, unwanted hair on the face, nipples, anywhere you have unwanted hair, and the cystic acne, as well as the irregular periods. Now, when we think of root causes, I like to think of sort of getting to the deepest level of what's causing something. Insulin resistance can be a deep root cause. As you say, 70% of women with PCOS have insulin resistance. When insulin resistance is the very bottom root cause, it's when insulin resistance is genetic, and that can happen. You can have a family tendency to insulin resistance that because of how, there's the family tendency, but then you ate the family diet at home and that activated when your puberty started for you to be insulin resistant. But I also want to go a little deeper and say that there are a lot of factors that are even deeper root causes that can lead to insulin resistance. So a typical diet, which is high glycemic, high sugar, high carbs that so many of us are raised on. Stress, environmental toxins. So a lot of endocrine disruptors, we think of them as disrupting estrogen, but they can also disrupt insulin. They can also disrupt the hunger and satiety hormones. They can also disrupt our thyroids. They don't just affect estrogen. So when we go deeper, even like there's the root causes, like there's the root, there's the tap root, but then there are all these rootlets that still come down from that. When you talked earlier about, Johanna, about the life cycles and how PCOS affects across life cycles, insulin resistance is really important because it is not just causing PCOS. And we historically have thought of PCOS as a hormone condition, but it's really a metabolic condition that causes hormone symptoms for most women, at least the 70%, right? And the problem there is that you can take the pill, you can do androgen suppressing medications, but if you don't change the insulin resistance, that's the underlying thread throughout our lives that later can become diabetes, heart disease, dementia, etc. So that thread of insulin resistance, when it shows up in teenage years, it might be causing those elevated androgens that are causing things that are terribly distressing to teenagers, like weight gain, acne, hair loss, unwanted hair, like the things that are embarrassing at a lifetime, at a life cycle when physical appearance is so important. And then in our 20s and 30s, into our early 40s, when it's affecting our fertility, or when we just can't figure out when our periods are coming because they're 3 months, 6 months, 8 months, right? And the fact that we might skip periods for a really long time could actually even increase endometrial hyperplasia and endometrial cancer risk. As women get into our 40s and 50s and beyond, even though the estrogen and progesterone start to go down as we enter perimenopause and menopause, that insulin resistance may still be there. And that insulin resistance becomes now much more significant because throughout most of our lives, women have a much lower risk of cardiovascular disease than men. But when we get into our 50s and into postmenopause, that risk matches men or exceeds men. We also have a higher risk of dementia, which has been called type 3 diabetes because of the inflammatory, metabolic and cardiovascular changes. It increases our risk of stroke, and women are at much higher risk of all of these things as we get older. We're also at much higher risk of dying from heart attacks because we're much less likely to be diagnosed with one when we're having one. Oh, it's just anxiety. Oh, it's just stress. That's why you're having these weird symptoms, because women can have atypical symptoms. So addressing the insulin resistance is critical. Caloric restriction in and of itself is not what is going to help with PCOS because you have to shift metabolism. So the two things that we can do most importantly to shift our metabolism with PCOS, and you can do either of these and get benefit, actually, according to the research studies on this, but ideally you're doing both because they're both helpful for you. And that is significantly increasing our protein intake and significantly increasing our high intensity exercise. Now, it doesn't mean you have to like push your adrenals and go crazy with exercise, but it does mean that you are raising your heart rate. It could be going on a hike at an incline, 3 times a week. It can be getting on a bicycle, even if it's a stationary bicycle, and then weight training, because weight training builds muscle, which increases mitochondrial amount, which increases the amount of energy that our cells are burning. Now, it is important, and I don't encourage people to count calories at all, but it is important to reduce empty calories. So any carbs that are not giving you nutrition, white rice, white bread, over reliance on potatoes and pasta, and lean more into whole grains. Learn about how to make potatoes more resistant starch. That's great. Legumes. These are important, healthful foods that have carbs in them, carbohydrates in them, but also help with metabolism and cardiovascular disease prevention and diabetes prevention. So again, the two biggest shifts: increase your HIIT training, high intensity training, and your protein. Protein can be plant-based and it can be animal sourced. I especially recommend leaning more into fish and a little bit of poultry and a little bit of lean meat, but not too much red meat because that isn't always optimal for everyone. But it's fine, like once a week. And make sure that you're getting legumes 3 or 4 times a week. So lentils, chickpeas, those are great options. And they can be small portions. The other thing with eating meat is we're not talking about like a 24-ounce porterhouse steak. We're talking about like 6 or 8 ounces. You can also increase your protein by using good quality pea protein or hemp protein in your foods and in your smoothies. And you don't have to be restrictive. Like you don't never have to ever eat a cookie or ever eat chocolate or ever eat a piece of cake. But I like to think about it as 95-5. If 95% of the time you're eating really healthfully, then you can generally afford 5%. It's not going to send your blood sugar into a spin. But first, I would say spend a few months where you're like really, really focused on getting that blood sugar steady, and then, then do the 5%. But we do know that we give ourselves room to have a treat, if you will, like a couple of squares of dark chocolate or, one evening a week, every Friday night, you're going to have your favorite portion, not container, but portion of ice cream or whatever it is. You also have that to look forward to, and your brain doesn't register restriction as much. So there are ways to look for insulin resistance on blood work. The problem is that many women with PCOS are having insulin resist. They're so sensitive that the normal levels for insulin resistance that would measure as abnormal on a lab are still higher than what you're experiencing as. So you can't, like I have a patient, I just checked her for insulin resistance and blood sugar. I checked her hemoglobin A1C. She is actually pre-diabetic. She's 1 point away from diabetic. And she does have elevated insulin. But I've had patients who clearly have PCOS, and when you look at their insulin resistance or what's called the HOMA-IR score, it looks normal, but they still have abnormal blood sugars. They still have all the signs of PCOS. They have the sugar cravings, all the things. So I still treat them as if they have insulin resistance. And here's one really interesting way of looking at this. So I work with women across all life cycles and across all ages. And I can't tell you how many women over my decades now, both working in the hospital, conventional clinic, and my practice, are in their mid-50s or 60s. And now they are pre-diabetic or they have diabetes. and their body has spent decades now in that high inflammation state. Well, I would never say that having a medical problem of any kind is a blessing. What does happen if you find out that you have PCOS in your teens or your 20s or your early 30s is you actually have an opportunity to adapt a lifestyle that pretty much everyone, if they adapted it, would reduce their risk of dementia and heart disease and diabetes and all the problems later on. If you find out in your teens and 20s that you have PCOS and you're able to really learn to work with your blood sugar, you will have an easier time getting pregnant, lower risk of miscarriage, lower risk of gestational diabetes, lower risk of complications. So it's a blessing in disguise in the sense that nobody wants this diagnosis, but it's actually like you're getting a really early signal that something is up that most people don't get till they're later. So you're more sensitive to what is now a global medical crisis of insulin resistance and diabetes. And it gives you a huge, huge opportunity to get ahead on that. Even if you have genetic predisposition, it doesn't mean you have to end up with diabetes later. And that's why it's so important. And it's so important if in menopause, it's tricky because you're not getting your periods anymore, right? Your estrogen and progesterone have gone down. You're not getting all the signaling. So you might miss the fact that nobody ever told you this was because of insulin resistance. So it's an especially important time, even if you're not technically having PCOS anymore, or like you're out of that phase of your life, to still really stay aware of that. You can do things like a continuous glucose monitor. I don't recommend it for everyone, and I don't recommend it for long stretches of time. But if you aren't sure, if you're not sure how to measure and trend and adjust your lifestyle to your blood sugar, a continuous glucose monitor, you can do a finger stick, a few times a day. A CGM can be really helpful just for like 3 months to really say, oh, when I eat that dinner and then I take a walk, my blood sugar is actually better. And then you can kind of use blood sugar as a proxy for insulin resistance. You can't check your insulin resistance at home, but you can check your blood sugar. And once your blood sugar starts to regulate out, your insulin resistance should improve.
And it's like a tool of self-knowledge, right? That you will know and
Exactly.
understand how your body works.
Exactly. And the beauty of it is that even though PCOS can feel so out of control, and I'm not saying that every single thing is like a miracle cure and every symptom is always going to be perfect. There is so much you can do to reverse that diagnosis, as long as you just always remember that you have a predisposition to something. And that for you, if you had a diagnosis of PCOS at one time in your life, you generally want to remember to be more thoughtful about your approach to sleep and what you eat and your exercise. But again, if everyone were doing that, that would be amazing.
Yeah. I love all those tips, very concrete tips.
And for those of you who ever are having trouble with cravings or binging, like that's a whole other, like that will settle out once you start to increase your protein, really getting like 25 to 30 grams at a meal. Or if you get a little bit less at a meal, have a protein smoothie like a high protein smoothie to balance, to add that extra protein. But when you get enough protein and also good quality fat like olive oil, avocado, nuts and seeds, especially like almonds, walnuts, and pecans, those are the healthiest nuts you could possibly eat. And then seeds can be really helpful. I don't recommend seed cycling, but if you like to seed cycle, great. But just making sure that you're getting a couple of tablespoons of seeds in your diet most days of the week. It could be a tablespoon of tahini. It can be some sunflower seeds that you toast and throw over a salad. It can be some flax seeds or hemp seeds. Those are really healthy for your progesterone levels and your estrogen, testosterone. Yeah, so those are just some important things you can do, but that will also help to reduce the cravings. And then of course you have to do the practical things like not have 3 bags of cookies or bags of chips and stuff like that in hand's reach, because who doesn't eat them when we have access to those? So
Tempting.
yeah, they are tempting. Well, and they're satisfying. It's not just that they're tempting, but like there's something happening in your PCOS brain that doesn't turn off until you get those foods. So that's the metabolic switch that has to happen. There are hormones called leptin and ghrelin, and these are produced partly by adipose tissue around the waist, but they're produced in other places too. And it's literally like, I think of ghrelin, it was like a gremlin. It always like sounds like gremlin to me, but like it makes you want to eat until you eat that carb or that sugar, and then it actually flips a signal off in your brain. So it's not that you don't have willpower. There's actually something happening that can take a little time to make the metabolic shift. So it's important to give yourself grace and time and support. Do it with other women.
Yeah, find the sisterhood.
Definitely.
So I'm looking at the time. Oh my God, I had so many other questions, but I want to see if anyone that's in has a question. So if you have a question, you can put it on the chat or you can unmute yourself and ask Dr. Aviva.
Do you want to read them to me as you see them?
Yeah, let's see. Let's give a bit of a chance. If not, I can ask another question and then
Ask a
see.
question, and then if
Yes.
somebody wants to put it in, nobody has to be shy. There's no question that's too basic or silly. And honestly, if you're thinking it, someone else is thinking it, and they might be too shy to ask. So you're doing everyone a favor when you ask a question, if you have one.
Okay, I see. Marta says, what do I have to consider when also having endometriosis?
I really feel for you. That's a lot to take in, right? To have both of those at the same time. The good news is that a lot of the things that we do for endometriosis reduces inflammation, and that can help with reduces inflammation, and that can help with endometriosis pain. And also, as your hormones get regulated and you're producing more progesterone, healthier levels of estrogen, as you are cycling regularly, that will help with the endometriosis as well, right? If you have if you have endometriosis and you're not getting a period for a few months, and then you have like this heavy period and a lot of inflammation, that can make it worse. The thing with endometriosis that I would add on, and this is critically also important for PCOS and blood sugar health, is to make sure that you're getting a really wide variety and a lot of vegetables and also berries. So blueberries, blackberries, raspberries, those all contain plant chemicals that reduce inflammation, but also help to balance blood sugar. So to me, the best treat you can eat if you have PCOS or endometriosis and you're looking for a snack is some frozen berries or fresh berries. Take frozen berries, let them come to room temperature, grate in or chop in some good quality dark chocolate, or just enjoy the berries by themselves. You can eat them frozen, like make a little bowl of them and eat them frozen, or fresh berries. And then lots and lots of leafy green vegetables, because those also help reduce that inflammation. In Hormone Intelligence, I have protocols for PCOS and endometriosis that you can combine, where I also talk about specific herbs and supplements. But ultimately, it really does come down to the lifestyle. Those are the biggest impacts. The other thing that we didn't talk about, which is, I mentioned how endocrine disrupting chemicals affect us in many ways. We know that they contribute to endometriosis, and we know that they contribute to PCOS. They also contribute to weight gain. They're called obesogens. So everything you can do to reduce your environmental exposure in your home, and especially your cosmetics, but also exposure to plastic packaging and drinking bottles, can actually help to reset your hormones. And that's important for endometriosis and PCOS. And then going to another level, microbiome is really important. And then with endometriosis, interestingly, making sure that you're working to get enough sleep, because when we're tired, the pain is always worse. So sleep is such an issue across our life cycles that we want to make sure that we're doing everything we can. And I'm saying this as a menopausal woman who is currently working on my own sleep for the first time in my life. I've never had sleep problems. It's challenging, but we feel better when we get good sleep too.
So let's see. Yeah, well, we get some other questions. I wanted to address for healthcare providers. Do you have some words of, what they should be looking for when they're supporting women with
Yes,
PCOS, which are also
yes,
entering menopause, and this
yes.
whole thing with the
have
hormonal,
to, you
replacement?
have to understand the symptoms. It's not just hair loss, acne, and unwanted hair, right? Those are the androgenic cardinal symptoms. It's not just looking for a string of pearls on an ultrasound. It can be much more subtle. It can be weight gain with difficulty losing weight. It can be depression. It can be anxiety. It can be irregular menstrual cycles without all of the other symptoms. It can be food cravings. It can be binge eating disorder. So really look at the wide array of symptoms that women with PCOS experience. Put the symptoms together. Don't see women's symptoms as separate. Oh, she's got binge eating disorder and she skips periods every 4 months and she has cystic acne. Like those aren't separate things. This is one body. So look for the things that connect the dots. Because if you start to connect the dots, you'll be like, oh, PCOS probably. Run labs, but don't dismiss the fact that somebody could have PCOS, even if the labs are normal. If the labs are abnormal, that confirms PCOS, but you can have absolutely normal looking labs, hormone, blood sugar, all the things, and absolutely have PCOS. So look at the person. If it walks like PCOS and talks like PCOS, it's probably PCOS. And listen to women and be supportive, because this is not just a physical diagnosis. There's a lot of psycho-emotional stress that goes along with discovering you have this, with living with this. It's work to address it, and make sure you know more than just drugs. Like, yes, drugs can be very helpful. We need pharmaceuticals too, but make sure that you have other options, and don't fat shame anybody. Don't tell somebody if you just lost the weight, because that is a wrong answer. That's bad medicine.
What about, again, because some of the people we work with, or we hear in their stories, they're on the pill for treating some of the symptoms, and then when you're entering menopause, there's all these other symptoms like the sleep disruption, etc., that a lot of women are struggling with. How is that interaction between being on the pill and then getting the support for hormonal replacement therapy in menopause?
So I am not opposed to having the pill be a great medicine for you if it's helping you with your PCOS. And actually, many women who are on the pill find that if they stay on it and transition into menopause on it, if it's like a low estrogen, low progesterone, or even just the progesterone, find that their transition into menopause is actually fairly smooth. So you may just want to stay on it. That is another form of hormone replacement therapy or menopausal replacement therapy. So if you're getting benefits for your PCOS, you are absolutely welcome to stay on it. You don't have to go off of it. If you want to go off of it just to see how you feel, you can go back on it. You can go on hormone therapy if you need it, or you can try natural alternatives. There's no one set of rules of how to do that.
And what about if you were managing the PCOS without birth control, but now you would like to get some of the benefits for the menopausal symptoms? Like where is that
Yeah, you can either
intersection?
you can go on the pill, or you can go on hormone therapy. And there's so many options.
See if there was any other questions from the audience.
Edit that part out.
Now is your time, because we are soon wrapping up.
Yeah. I have till 10 o'clock my time. I have 10 minutes.
Can you explain why counting calories is not recommended for weight loss for PCOS from Rebecca?
Yeah, it's not that you don't have to count calories. You can count your calories if you want to, but what's more important is the quality of the food you're eating and understanding food size portions. So if it helps you to count calories to learn to do that, fine. But you could eat, you could eat 1,000 calories of a healthy hummus. It's still not any better. Or you could eat, 200 calories of, I don't know, Snickers bars. Do you have Snickers bars over there? Chocolate bars that aren't, junk food, and that's not any better. So, just because you're getting less calories or more. So really what you want to understand is how to eat for metabolic health, what your body's energy needs are, what is the amount of food energy that you need to get in a day. And it's more important to think, am I getting enough protein? Am I getting a good amount, like a tablespoon of olive oil with each meal, or 1 tablespoon of olive oil at breakfast, and then a half avocado at lunch, and then some salmon at dinner, so you're getting those good fats. Understand what a portion of grain is, right? That's usually like a third or half a cup cooked. So that you start to recognize what you're putting on your plate rather than having to get fixated on counting calories. If you know what your metabolic needs are, you work with a nutritionist who can, or an exercise physiologist who says to you, okay, for your exercise level, you need this amount of energy per day, and here's how to get it. Sure, you can look at that from a calorie perspective, but I also think that calories are so conceptually tied to diet culture that I think we can get a little crazy, focus on that rather than focus on what is good food and how much of it to eat. Similarly, I don't encourage women to focus on their weight. If weighing yourself helps you to sort of stay focused and stay on track and see the benchmarks you're making, great. But what's more important is actually building strength and building muscle. And that you may not lose weight actually, because muscle weighs more than fat. So as you're building muscle, you may improve your diet dramatically. You may start lifting weights, exercising, doing all the things, and your weight doesn't budge, or maybe it like budges 2 pounds and gets stuck, but now your pants are fitting more comfortably. Your arms feel more, comfortable in your sleeves. You're not having to lay down to zip your pants up, all the things. That in and of itself is more important. And the most important measurement is actually your waist circumference. And if that is going down, your pants or skirts are fitting just a little bit lower on your waist, they're easier to button. That is more important than the number on a scale for your actual cardiovascular and metabolic health. So that's what I encourage my patients to do. I encourage my patients not to weigh themselves unless they're someone who, sometimes women who have had disordered eating, they need to like keep that touchstone to sort of for their mental health. But other than that, you don't have to.
There is, let's see, on low progesterone because of endometriosis. Can I
Mhm.
combine that with estrogen in menopause?
Yes, absolutely.
And then I have PCOS and do believe my mother has it as well. She's now 60, and I wonder if there is some special hormone you recommend to use regarding the menopause. She's struggling a bit, and I want to help her.
Oh, there are basically 2 or 3 options. There's progesterone or progestins, bioidentical or not bioidentical. There's estrogens, estradiol, multiple forms of that, and then testosterone or androgens. And it depends on what you use, depends on really what symptoms you're having. So, for example, if I have a patient who comes to me and she's having trouble falling asleep, but she doesn't have vaginal dryness or hot flashes, she's mostly just got sleep and mood issues, I'll just use or usually oral micronized progestin or progesterone troches. They're little tablets. If she's having vaginal dryness, hot flashes, et cetera, then I might use estrogens. And then if she's having, I don't use testosterone a lot, but if she's having, issues around drive, motivation, energy, just that like get up and go, or low libido, or difficulty achieving orgasm, then testosterone might be helpful. And then different forms. So if someone is having vaginal dryness, it might be a vaginal suppository. If they're having more general symptoms, it might be an estrogen patch. So there's a lot of choices out there that you can pick and choose from. And a good menopause, a good women's health provider, nurse practitioner, or nurse midwife, or you have GPs over there, should be able to help, or a gynecologist. And if not, there are great resources online.
Are there any known experiences or benefits from taking the Wegovy or Ozempic? This is the
Yes.
G1, LP.
Yes, it is not my favorite recommendation for 2 reasons. Well, for several reasons. One is that it has side effects. 2, it's extremely expensive, at least here in the US. I don't know how about for you guys, but here it could be $800 for a month's worth, and it's often unavailable because so many people are using it, including people who are using it inappropriately. And while it can help with weight loss and blood sugar, it's still not getting to the deeper addressing inflammation and the micronutrients that we need through our food, through what we eat. But look, if you're really struggling with your weight and you just are doing everything and it's not coming off, and you've tried all the things, or you just don't have the bandwidth to try all the things, you're stressed, you're tired, whatever's going on, you've got teenage kids, parents that you're caring for, you're in graduate school, you've got little children, whatever. It's certainly an option. There's, the whole class of drugs that can be used, not just the Wegovy, but it's absolutely an option, and it has been shown to improve blood sugar. I'm also not opposed to metformin, not for the weight loss, but for blood sugar. Metformin can be very helpful. So if you're really struggling and you're doing all the things, sometimes these things are a nudge, right? It's like a car that won't start and you need help pushing the car. And then when this car starts going downhill, the motor kicks in. Think about it like that. You've all seen a movie where that's happened, right? And you could think of the Wegovy like that for weight. You can think of the metformin like that for blood sugar. And again, Wegovy helps with both.
I think we don't have more time, right? We're out of time.
So.
Where can people find you, Aviva?
Yeah, you can find me at my website, which is just avivaromm.com. And there's tons of free articles and information and resources there. You can find my books, Hormone Intelligence and Adrenal Thyroid Revolution. And then I hang out on Instagram. So I don't post a lot, but I post regularly. And that is just Dr. Aviva at Aviva Romm, at Dr. Aviva Romm on Instagram. And that's me hanging out in the comments. So you can always ask me questions there. And then I have, for those of you who are professionals and looking for practitioner training, my Women's Integrative and Functional Medicine Training Program is a deep dive. It's a 16-month program, 10 months with me, and then 6 months overflow to do on your own, of full root cause medicine for women with extensive information on PCOS, menopause, endometriosis, and all the things. So you can find out about that also over at my website. If you just go to the homepage, look at courses, the drop down, it's the Women's Integrative Functional Training Program.
Thank you so much. Thank you so much.
Thank you for having me, and just such great questions from you and the community. And I just wish all of you, such good health and having the good fortune to find the people who can really help you continue to get the answers that you need. And I just want to say, hope is so, have the hope, have the confidence, because I have seen so many women transform their lives, transform their fertility, transform their skin, their hair, get comfortable in their bodies again, and really, really move out of those pre-diabetic and diabetic ranges back to normal blood sugar and insulin resistance. So you can do it. Just don't do it alone. Have a team, have people.
Yeah, and if you want to have the team, we are here at PCOS Norge, so you can go to our website and also check out and become a member if that's what you need. Thanks so much, Dr. Aviva. It was a pleasure to talk to
Thank
you.
you, everyone. You too.
Bye.
Bye, everybody.